We hear so much these days about, the latest procedures, things promising big changes. But how do you really know what's solid science versus, well, just good marketing?
That's the core question, isn't it?
Yeah, so today we're going to take a closer look at one specific procedure that might have popped up on your radar, the Vagilangelo procedure.
Exactly. And we've got this scientific validation report to guide us. It's by Dr. Reza Lankarani, very recent, from April 2025.
Okay.
And it's a peer-reviewed analysis, basically looking hard at the science or lack thereof behind the claims on the Vagilangelo website. That's vagilangelo.com.
Right. So for this deep dive, the mission is pretty clear then. We want to unpack what this Vagilangelo thing actually is. Look at the real evidence for whether it works, if it's safe,
Crucial points.
and, how does it stack up against other things out there?
And it's so important we approach this critically, right? Stick to what the scientific validation tells us.
Absolutely. So let's just jump in. Can you break down the Vagilangelo procedure for us? What are we actually talking about here?
Okay, so the report says it's a minimally invasive technique. Think vaginal rejuvenation. It was developed by a Dr. Amir Marashi,
Right.
and the main aim, apparently, is to boost sexual satisfaction by restoring the vagina's natural angle. That's the term they use.
The natural angle. Okay, that's interesting phrasing. How do they go about doing that?
Well, it seems to be a combination of things. They use internal sutures plus injections of PRP, that's platelet-rich plasma.
Ah, PRP. We hear about that in other areas too.
We do. And the thinking here is, use the body's own healing factors in the plasma to maybe stimulate tissue regeneration in that area.
So sutures for structure and PRP for regeneration, maybe.
Yeah.
What's the actual procedure like for someone having it done?
It's apparently pretty quick, around 30 minutes, they say, and it's done under local anesthesia.
Okay, not general.
No. And the recovery time is also pitched as relatively short, something like 2 to 3 weeks. The website really positions it as like a less intense alternative to a full traditional vaginoplasty.
Okay, faster procedure, quicker recovery. You can see the appeal on the surface, can't you?
Definitely.
So let's get to the validation report from Dr. Lankarani. What were the big takeaways? What did the analysis find?
Well, first off, the report does give it some credit. It acknowledges that the procedure targets an anatomical feature, this angle idea that hasn't been studied a whole lot.
Right.
So, theoretically, exploring that could potentially refine how surgeons think about these things, maybe lead to better patient outcomes down the line. Could be valuable.
So a potential positive, maybe opening up a new area of focus.
Potentially, yeah. But, and this is a big but.
I suspected there was a but coming.
Right. This is where the science, or the current lack of it, really comes into play. The report found some pretty significant weaknesses in the scientific backing for Vagilangelo as it's presented right now.
Okay, lay it on us. What were the main red flags?
The biggest one, really, is the absence of peer-reviewed evidence. We're talking proper clinical trials, long-term follow-up studies, that kind of rigorous data.
Gold standard stuff.
Exactly. Peer review is just fundamental. You need other experts to vet the methods, the results. Without that, it's incredibly hard to say objectively, how well does this actually work? Is it safe long-term? Do the effects even last?
So a major evidence gap.
A huge gap between the marketing and the validated science, yeah.
That makes total sense. Without those studies, it's all a bit hazy. What else did the report flag up?
It also pointed out something interesting. The Vagilangelo website itself apparently mentions that the procedure provides only limited tightening compared to a traditional vaginoplasty.
Oh, okay, so they state that up front.
Seems so. And that's really important for managing expectations, isn't it? Someone going in expecting major structural tightening might be disappointed.
Yeah, absolutely. Managing expectations is key. What about the PRP component? You mentioned that earlier.
Yeah, that's another area report questions. Look, PRP is used in orthopedics, dermatology. It has potential. But its specific effectiveness for this application, enhancing vaginal sensitivity, boosting regeneration right there. There's just not strong scientific evidence for it yet. The report even mentions a broader review article, I think it was in Cells, that discusses how PRP results can be really variable, depends heavily on where you use it and what you're trying to achieve.
So the PRP benefit here is more theory than proven fact at this point.
That's pretty much what the report implies, yes. And one more thing, those high satisfaction rates you might see on the website.
Yeah, the testimonials.
The report flags those as anecdotal. Look, patient stories are valuable. They tell you about individual experiences. But scientifically, they don't carry the weight of, say, a large controlled study.
Right.
There's always a risk that a few glowing reviews don't really represent the average outcome.
Yeah, anecdotes aren't data, as they say. Okay, so that's the view on Vagilangelo specifically. How does its evidence level compare to other, maybe more established or studied, vaginal rejuvenation techniques?
That's a great question for context. The report basically suggests that while Vagilangelo is a unique approach, it's kind of lagging behind in terms of published research compared to some other methods out there.
Such as?
Yeah.
What else has been studied more?
Well, the report references literature, like a 2023 piece in the Journal of Sexual Medicine, that looks at various minimally invasive techniques. And a recurring theme across that research is the call for standardized outcome measures.
Right, ways to actually compare results properly.
Exactly. And the need for long-term data. These are things the wider field is grappling with, but Vagilangelo seems particularly lacking in these areas right now, according to this report.
So it's not alone in needing more data, but maybe it's further behind the curve.
That seems to be the implication. There was another article mentioned, 2022, American Journal of Obstetrics and Gynecology, just hammering home the need for clinical trials for any new gyno innovation because outcomes can vary so much.
Exit.
Then you've got the energy-based devices, lasers, radiofrequency treatments.
Right, those have been around a bit longer, haven't they?
A bit. And the report mentions studies, like one by Critchman et al. From 2021, that show some, let's say, preliminary evidence suggesting they might work. But even those studies usually end by saying, we need bigger, better trials.
Okay, so even for lasers and RF, it's not totally settled science, but there's some data starting to emerge.
There's some. And then you look back at older reviews, like one from PMC in 2017, discussing the whole field. It basically said surgical vaginoplasty is well established, but all these non-surgical options, including energy devices and implicitly things like Vagilangelo, need more research.
Right.
And even earlier, 2016, another PMC article on energy devices talked about their potential for collagen production, but again, called for longer-term studies.
So what's the key difference here in terms of evidence?
I think the main point the report makes is that energy-based devices, while still needing more work, have at least garnered more research attention. There's some initial clinical data out there.
Okay.
Vagilangelo, according to this analysis, just doesn't have that level of published evidence yet, which, from a purely evidence-based standpoint, puts it at a disadvantage right now.
And it's worth noting, isn't it, that Vagilangelo does use sutures. It's not purely non-surgical like a laser treatment might be.
That's a really good point the report brings up. Because it involves that surgical element, the suturing, you could argue it's potentially a step more invasive than just using energy. Even if it's way less invasive than a full traditional vaginoplasty, it sits somewhere in the middle, maybe.
Interesting distinction. What about the big medical societies? Do they have a stance on these kinds of procedures?
Well, groups like the American Society of Plastic Surgeons, ASPS, they definitely acknowledge that non-surgical aesthetic genital stuff like RF and lasers is getting more popular.
Yeah, you hear about it more.
But they also strongly emphasize the need for standardized ways to measure if these things actually work, those outcome measures we talked about.
Right.
And the report suggests that because Vagilangelo hasn't really undergone that kind of rigorous scientific scrutiny yet, it's hard to even compare it properly using the frameworks these societies are calling for.
So summing up the perspective from this validation report, the overall vibe is caution, mainly due to the lack of solid evidence.
That's a very fair summary.
Yeah.
The core message is interesting, novel approach, but the effectiveness, the safety, it's just not confirmed by robust science at this point.
And potential patients need to know it explicitly offers less tightening than traditional surgery.
Correct. And also the added benefit from the PRP component in this specific context, still largely unproven by research.
Got it. And those compelling satisfaction rates on the website, need to take those with a grain of salt, as they're anecdotal.
Exactly. They need confirmation through proper studies. So given all that, the report's advice is pretty clear. Caution is warranted for doctors thinking of offering it and for patients considering it, at least until we have more solid clinical data.
Which really points to the next step, doesn't it? More research.
Absolutely. We need well-designed clinical trials. Ideally, ones that directly compare Vagilangelo head-to-head with other methods, both surgical and non-surgical.
That's the only way to really figure out where it fits, if at all.
That's the path to clarity, yeah. To really evaluate its role properly.
Well, this has been incredibly insightful, really drilling down into the science behind one specific procedure. And for you listening, hopefully this deep dive underscores just how vital it is to look critically at any new medical procedure, right? to ask about the level of scientific evidence backing it up.
Yeah.
Because even ideas that sound innovative, like this natural angle concept, they absolutely need rigorous testing to prove they're safe and that they actually deliver on their promises.
It really makes you think, though, doesn't it? With medical tech moving so fast, what's the responsibility here for developers pushing new procedures and for patients who are seeking solutions?
That's a great point.
Maybe the provocative thought for everyone is, when you encounter any new treatment in any field of medicine, what are the really crucial questions you should be asking to make sure you're grounding your decisions in solid science, not just hope or hype?